Hi, my name is Brian Galvin. Today I will be doing a presentation on anorexia nervosa, which is the disease slash illness that I chose for Bio 231 with Professor Gelota. So anorexia is an eating disorder and it is a phobia of gaining weight, which causes a very unhealthy low body weight. It's really commonly known. Most people associate it with um, people who are really skinny and have almost no body fat. People with anorexia will do anything within their power to keep low body weight. They will exercise excessively. They will refuse to eat, and they will misuse substances such as laxatives. And sometimes it could lead to bulimia, which is induced vomiting. Um, the unhealthy eating habits are the main symptoms that a person undergoes if they have anorexia, and fear of gaining weight even after losing excessive amounts. We are in a day and age where social media creates a false sense of body image, and this is one reason why people fear of gaining weight. This pathological disorder is interchangeable with depression and can lead to depression could essentially lead to anorexia, or vice versa. Anorexia could lead to depression because of the malnutrition of the body. The malnourishment of food can affect the emotions of a person, as well as fatigue, dizziness, and cause mental and physical disorders. The symptoms of anorexia are closely related to starvation. The signs of anorexia include fear of gaining weight and emotional issues that disrupt the perception of weight. What this essentially means is um, the, the people with this mental illness will see their body weight and their body image as different than it actually is. For example, their waistline could appear bigger than it really is, and this just creates an ongoing process of starvation or things that they do to not gain weight. The symptoms of people may vary as there are a number of variables that can be considered for a person to be unhealthily skinny. Um, for example, the body weight of someone who is taller will generally be heavier than that of someone who is shorter. This isn't always the case, but is just an example. Um, it also relates to genetics, as people may have a harder time losing weight than others. So some people can be more affected through it because there are genetics that essentially create a harder time of gaining weight. With this in mind, the clear symptoms of a person who has anorexia is a fear of losing weight, and they tend to hide these symptoms. The physical symptoms of this disease include large weight losses or a very skinny appearance, yellowish skin, fatigue, drowsiness, dehydration, and signs of vomiting or binge eating. Anorexia often leads to other eating disorders such as bulimia and binge eating disorder. The behavioral and emotional include not eating, excessive exercising, lying about how much food has been eating, fear of gaining weight, and constant measurement of weight and limited emotion. Essentially, eating disorders are kind of interchangeable. One can lead to another, or you could have both. Essentially, um, anorexia is basically the fear of gaining weight and just the misperception of of weight. Whereas bulimia, you still are trying to not gain weight, but you do that by induced vomiting. For binge eating disorder, that's where you eat a lot of food and you'll essentially eat it at one period of time. So they're kind of interchangeable within themselves. Um, the causes of this disease is yet unknown. It is closely related to emotional and physical status and includes biological, psychological, and environmental factors. Psychological factors include social media and the idea of perfectionism. This factor is closely related to biology because the natural born traits of people can lead to anorexia. People may have traits that makes them want to strive perfect body, and the way that social media portrays body image can lead to anorexia. It makes it kind of harder on them to have this perfect body, so they'll essentially try to match the false image that social media portrays. Biological factors are not directly involved in genes, but rather with genetic tendency of traits that have higher chances of developing this disease. Environmental factors all relate to stereotypes of the society. It has always been a stereotype that the thinner you look, the prettier you are labeled, or the prettier you look if you are skinnier. This is because in modern Western culture, this is pushed, and with technology and social media, it kind of makes it harder for people to be more confident about their body. The pathophysiology of anorexia, according to research, include low levels of gondol hormones, reduced levels of triiodothyronine and thyroxine, and an increase of cortisol emission. The malnourishment of the body affects every organ in the body, whether that's the heart, the brain, the stomach, and bone mass decreases as well. If induced vomitings or the use of laxatives occurs, then the person could suffer from dehydration, metabolic alkalosis can occur, and serum and sodium or potassium can be very low. Death can also occur due to irregular electrical signs due to the ventricles of the heart, which is also referred to as ventricular tachycardia. It affects the heart with problems with the cardiac muscle mass, chamber size, and output decrease. Identification of anorexia is very hard because the people with this illness will essentially refuse help or speak out. And this is why those who have suffered in the past speak out and try to make this aware to the people that there is help. It can be hard to recognize the low body weight and denial of eating, as they tend to use baggier clothing, so you can't really see the low body weight, and they will essentially lie about what they have eaten. So it's kind of hard unless you're very vigilant with the person. These are the main features of the disease. The criteria for diagnosis is not eating, behavior or fear of gaining weight, and a misperception of body weight. Physicians will usually test for mental disorders, as this can cause the disease. There is no other diagnosis that corresponds to anorexia due to the fact that it is the only mental illness and disease that corresponds with the distorted body image. The management for anorexia involves both nutritional treatment and long-term physiological treatment. For those who have had severe weight loss, they may be hospitalized until weight of the patient has been monitored and restored. This includes regaining the nutritional, fluid, and electrolyte levels back to normal, back to what they should be. The person should also undergo therapy for treating the mental and behavioral illnesses. Therapists will help control and maintain good eating habits, as well as help the patient with the body distortion standpoint. There is a 10% mortality rate for every decade, and it is recorded as the highest death rate of any mental disorder. This is for the people who seek help and does not include those who do not seek clinical attention. There will be times where people essentially self-cure themselves because they don't seek help. About 50% of the patients regain their weight and do not suffer any complications. About 1/4 of the patients will suffer moderate conditions and could suffer some complications, and the remaining 1/4 suffer long-term problems, including mental and physical complications. Since there is no identification cause of this disease, epidemiologists tend to focus on mental health to prevent this illness. Eating disorders in general have no identification causes, and because of this, it is important to spread mental health awareness and self-care awareness. Spreading information surrounding how social media creates a false sense of body image and how to speak out if you have a problem is the most efficient way of controlling the spread of this illness. I prepared this video.
Lots of people watch what they eat to keep fit and healthy, but eating disorders are driven by an intense fear of becoming overweight. They have a number of different causes, including sadness, low self-esteem, and a need for control. There's also lots of social pressure to be thin. The most common eating disorders are anorexia and bulimia. Anorexia involves eating less and less, even when you are below a healthy weight. Bulimia is binge eating and then making yourself vomit or using laxatives. Both disorders tend to start in your mid-teens. They can have physical effects such as brittle bones and liver damage. In women, periods can become irregular or stop. In men, erections may stop and testicles can shrink. Eating disorders are dangerous conditions which can lead to serious illness and even death. There's also binge eating disorder, where you diet and binge eat but without vomiting. It's not as harmful as bulimia, and sufferers are more likely to become overweight. If you think you may have an eating disorder, you need to talk to your GP as soon as you think something's wrong. It may have caused some physical problems, and some illnesses can mimic anorexia, so be sure to get a physical health check. Your GP may refer you to a specialist. Together you'll investigate how the problem started and how to change the ways you relate to eating. They'll also help rebuild your self-esteem. When you're ready, a dietitian can talk to you about eating healthily. There are also lots of things you can do to help yourself. Keep a diary of what you eat and how you feel to find links between the two. Try to understand the weight that's best for you and why. Challenge your eating patterns and how you view your body. Talk with family and friends to help them understand how you feel. Remember, don't be too hard on yourself. Getting better is a steady process, but with a little help you can go on to lead a happy, healthy life.
As far as anorexia, the earliest trace of modern cases was in 1689, when Richard Morton reported a lack of physical starvation due to quote-unquote nervous eating. 200 years later, a French and English physician created the term anorexia nervosa, in which they both described reports of this disease and the description of the illness. The differences in time periods have had its motivations for a refusal to eat, and each time period has different reasons. The earliest trace of eating disorders goes back to 325 BC, where in this time period, it could have occurred because of fasting and different cultural and religious motivations. As far as the reasons why people undergo anorexia in society today, could be because of social media and the way it puts pressure on people to kind of lose weight and have this perfect body image, quote unquote. Um, some statistics and facts: 9% of American women will suffer from anorexia. 1 of 5 of anorexia patients can lead to suicide. Around 50 to 80% of anorexia is genetic. Without treatment, 20% of people could potentially die. And 70% of people with an eating disorder do not seek treatment. This is why it is made clear that mental health awareness and self-care awareness is spread. It's a very serious eating and mental disorder, considering it has the highest mortality rate of any mental illness. From research, I have discovered that this illness mainly affects women, but is not only subjected to them. It could also happen in men. Both men and women feel pressured to look a specific way, and this could determine the development of an eating disorder. This could be because of family, because of friends, social media. These eating disorders could consume a person's life, and they are both mental and physical illnesses. Eating can affect the way they live, as they see food as something that makes them gain weight, and because of this, the fear will allow them to overanalyze what they eat. Some famous people that I researched who had anorexia and eating disorders. The first one is Demi Lovato. She was treated for anorexia and bulimia back in 2010. She's now a spokesperson for eating disorders and encourages outlook on mental disorders, because she also suffers from a mental disorder, which is bipolarism. Lady Gaga also suffered from anorexia and bulimia from the age of 15. Since then, she has written songs such as "Born This Way," and she has spoken about seeking help for the illness. Elton John also suffered from an eating disorder, which was not anorexia but bulimia. He suffered from bulimia and alcoholism and was treated for both of these illnesses. And he also admitted it was very hard to acknowledge and speak out about the problem. In summary, anorexia nervosa is an eating disorder as well as a mental disorder, which is the phobia of gaining weight. And this essentially is a domino effect of not eating, excessive exercising, and the use of laxatives or vomiting to get rid of the food in your system. The symptoms of anorexia are very closely related to starvation. Includes the fear of gaining weight and emotional issues that disrupt the perception of weight. The causes of this disease is still unknown, as well as all eating disorders. They are psychological, biological, and environmental factors which can occur as the causes for the disease. There is basic research. The most important is death due to ventricular tachycardia, and it mainly affects the heart as well as all the main organs because you are not eating and you're not supplementing your body enough. The identification of anorexia is very hard because they tend to refuse help and not seek support. So it is hard to recognize the problems with it, as well as they tend to cover up their bodies with loose clothing and they will lie about what they eat. It is important to go to a physician to treat this disease, as well as talking how it happened, when this happened, and how they could fix it both mentally and physically. There is nutritional and long-term psychological treatment for this. The nutritional revolves around supplementing your body to where it is healthy again. That includes the electrolytes you have lost, the hydration you have lost, and the supplements you have lost through food, all the vitamins and stuff, as well as the long-term psychological effects, which includes your mindset and how you can change the phobia of gaining weight and start slowly eating regularly again. There is no identified cause of this disease for epidemiologists, so they tend to focus on mental health prevention as well as self-care awareness. The history behind it traces back to the late 60s, where Richard Morton reported this eating disorder, and then 200 years later, it was finally given a name, which was anorexia nervosa. It's a very serious eating and mental disorder, and it's considered one of the highest mortality rates of all mental disorders. And some famous people that we covered was Lady Gaga, Elton John, and Demi Lovato.